So let's begin with knee as one of the first common injuries that I want to discuss in my beginner's guide to injuries for athletes who try to pick up sport as an active lifestyle. Knowing knee as one of the most important joints in our body, there could be a lot of clinical issues or biochemical issues that could be attached to the knee. Biochemical in the sense, knock knees is one of the things. Another important is flat foot. Having flat foot can biochemically have a lot of knee issues an individual can have in later life. Having said that, there could also be some clinical issues. For instance, arthritis, which could already be existing. For instance, just weak muscle. As a beginner, you could be having extremely poor muscular strength. You would not have got the right footwear that you're supposed to use, which may result into impact on your knees, and obviously the posture correction, which is very critical once we start a certain kind of training. So here are three questions that I usually ask my beginner clients who try to take up sport. Number one, do you have any of the biochemical issues? Because if you do, there is a certain kind of warm-up that one needs to do in order to prevent this kind of pain that can come from a biochemical issue. Another is, do you have arthritis? If you've been a person who've always had arthritis, who's been detected recently of arthritis, or has the beginning stages of arthritis, it would be wise if you consider a sport which is low impact on the knees. Because taking up suddenly running as one of your sport might not be the most wise decision. So say for instance, low impact sports like swimming, doing any kind of workouts in the water, aqua aerobics for instance, water polo as a sport are sports that would work very well for a beginner who has any existing or history of arthritis. Again, if you're just starting new, completely new, make sure your warm up, your cool down, your strengthening, foam rolling, all is bang on. You could be using bands for strengthening as well. So these are a lot of tips that also can be given to you by a physiotherapist or by someone who's into strength and conditioning. And also the other most important factor that we are looking at is if you've ever done any kind of exercise in the past. If you are literally someone who's just come out one day and want to take up a sport, it would result into poor posture, because of which your knee could not be in alignment with your toe when you're squatting, when you're doing a certain kind of an agility, you could not be in your right posture, and that again can be quite detrimental, and before you begin you might have to stop the sport. So get yourself checked, get yourself tested with a physiotherapist, get some strength and conditioning exercise before you start any kind of impact sports, which could be running or which could be an agility sport, and get leg strengthening done. Obviously strengthening around the knees is very important. Even as a beginner, even if you don't feel any kind of pain, just mild icing around the knees can prevent any kind of excess inflammation that can happen, so you can prevent and save yourself from a certain kind of an injury that otherwise would be happening. Also, it is very important to get some pathological reports in place. For instance, making sure your vitamin D3 in place, your RA factor is not very high, so you are not in any kind of a risk over there, and to make sure that your calcium levels and protein intake are bang on to prevent any of those dietary related injuries. So here it is, everything that you need to know about the knee, everything that you can do to prevent the injury, and everything that you can do to cure this particular thing from the diet point of view and from the exercise point of view.